My name is Kirstyn Brownson, and I'm a surgical breast oncologist at the University of Utah and Huntsman Cancer Institute. Many thanks to the Academy of Health Sciences educators for this opportunity to present my topic, Receiving Feedback in Healthcare, today as a TED Talk. I have no disclosures. As an informed, non-evaluative, and objective appraisal of performance intended to improve clinical skills, feedback is crucial to healthcare education. Healthcare learners have a very condensed educational period, and every minute and every learning opportunity needs to be optimized. Learners are primed to ask for feedback and have come to expect feedback after the performance of most tasks. Much attention has been paid in the healthcare literature on strategies for giving meaningful and effective feedback. Yet there is a paucity of literature surrounding how to best receive feedback in healthcare and why this can be a difficult endeavor. Receiving feedback in healthcare is as crucial to the process of professional growth as giving feedback. In fact, only focusing on the delivery of feedback robs the learner of being an adult learner, an active participant in their educational, personal, and professional growth. We have historically focused on the teacher and on instruction on how to give feedback. Knowing how to accept and respond to feedback is equally critical, however. If students become defensive, do not recognize feedback, or lack the ability to evaluate and incorporate feedback received, then no amount of timely, specific, well-intended feedback will matter. To be fair, most healthcare professionals receive no instruction on how to receive feedback, and feedback in healthcare can be especially difficult to receive. Furthermore, there is literature to suggest that healthcare learners are often dissatisfied with the feedback amount and type that is given. This highlights an important dissonance between feedback that is delivered and that which is received, and a dissonance between what learners think they need and what instructors feel that they need to communicate. Receiving feedback is difficult for everyone. It's human nature to bristle when feedback is anything but glowing. However, I think it is especially difficult for healthcare workers to receive feedback. As I've already mentioned, receiving feedback is a skill that needs to be developed, and in healthcare, this skill is rarely even taught. Next, most people working in healthcare are high achievers and type A personalities. We are already trying to do everything perfectly and just right, so to hear that we are not doing things perfectly is especially difficult. For learners in healthcare, these are people who are tasked with both learning and performing at the same time. Receiving feedback can be difficult as the learner is preoccupied with many competing tasks already. Learners may not even recognize that they are being given feedback, and this has certainly been reported in the literature. I think that this last point also applies for healthcare workers in general, not just learners. We are always being asked to perform a million different tasks at the same time, so receiving feedback during the course of our workday can be really challenging. Another thing that makes receiving feedback difficult is the struggle that many of us face working within the healthcare system. Doing our best work may seem thwarted by operating in an imperfect system. This can be really frustrating when we receive feedback that is not positive, and we recognize that a big part of this issue is the flawed system. Feedback can also be constant, especially when we start a new position, move to a new unit in the hospital, or are learning. When we are inundated with feedback, it is really difficult to sort through everything and to prioritize the most pertinent pearls. Along these same lines, healthcare is stressful. Receiving feedback optimally requires that the recipient is in a non-reactive and non-emotional state. When work and the learning environment are stressful, then we may not be at our emotional best. Additionally, a stressful work environment means that the feedback may not always be delivered in the most effective way. Feedback could be curt, seem like blame, or be really rushed and one-sided, where the recipient doesn't have time to ask questions or to reflect about the process. In healthcare, we deal with life and death situations. Receiving feedback that we did something wrong or could have done something better when it's tied to a life and death situation is especially difficult to hear. And to dovetail on this point a little more, it's easy for healthcare learners and workers to feel threatened when getting feedback. This is the case with getting feedback about life and death situations that we're handling. Feedback from patients is difficult because of the fear that this could result in a poor patient satisfaction survey result. And for students, there's fear that the feedback, when it's anything but glowing, is going to translate into a lower grade. Feeling threatened by feedback is not a good mindset to be in order to receive feedback effectively. Last but not least, in healthcare, we work in a hierarchical system, and much of the feedback that we receive is going to be from persons who weren't there and who do not know all the details about what transpired. This leads to one-sided feedback, where we often do not have a chance to tell our side of the story or to ask for clarification. On the other hand, receiving feedback in business is not a new concept. It's well studied, recognized as an imperative skill set that is very valuable and needs to be taught, practiced, and honed over time. As such, I turn to the business literature to collect tips for receiving feedback, which I'll share in the subsequent slides. Just about every article that I read can be boiled down to the following key points regarding key tips for receiving feedback. First, pause, breathe, and do not react when receiving feedback. If we react, we are not listening. Second, remind yourself about the benefits of feedback. And for some of us, this needs to be a mantra. Remember that getting feedback is a good thing. It shows that your instructor or colleague or boss is invested in you. It's an opportunity for growth. Next, listen to what is being said and work to understand this. Additionally, ask questions for clarification if there is something that you do not understand. Fifth, say thank you. Getting feedback is a gift. If you act upset or defensive or are not appreciative of the feedback, then you're not likely to get more in the future. Remember, getting feedback is a good thing. The last tip is to request time for follow-up. This really gets to the meat of why we want feedback, which is so that we can make changes in our behaviors or our performance. Asking for time to make these changes shows that you are engaged and that you're taking this information to heart, but it can also give you time to process the information and your emotions further. This next article focuses on the things that we do as humans when receiving negative feedback to cope. No one likes getting negative feedback, so much so that we have changed the name from negative feedback to constructive criticism. As a result, there are numerous mechanisms that we employ when hearing negative feedback to defend against this new information that threatens the way that we see ourselves. We need to recognize these coping mechanisms so that when we hear feedback that is negative, we will be more primed to listen to the feedback that we are given so that we can learn and grow rather than employing these counterproductive coping mechanisms that enable us to remain unaware of our blind spots. This article lists 13 ways that we justify, rationalize, or ignore negative feedback, which are to play the victim, to take pride in that has been criticized, to minimize the feedback, to deny the feedback, to avoid the information, to assign blame, to counter the information that's provided, to attack the messenger, to negate the feedback, to deflect, to invalidate the comment, to turn everything into a joke, and/or to exaggerate. Thank you so very much for your time, and I'm available for any questions.